In my work as a psychiatrist, I'm often trying to establish a diagnosis for people who are experiencing different types of mental health symptoms. Sometimes it's pretty straightforward, but a lot of the time it's more complicated. The reason for this is that many different mental health conditions have overlapping symptoms. One symptom can apply to several different diagnoses. Symptoms like insomnia, irritability, difficulties with concentration and focus, low energy, social withdrawal, and impulsivity can all be associated with a number of different mental health conditions. Sometimes I've run into challenges trying to differentiate between bipolar II disorder and borderline personality disorder. It's also been difficult at times to determine whether a person has complex PTSD or borderline personality disorder. Sometimes it took some work to figure out whether someone had ADHD or PTSD. There's a reason why I try so hard to establish the correct diagnosis. First of all, many people aren't able to access treatment without a diagnosis. Second, if the person doesn't have the correct diagnosis, they won't be receiving the proper treatment and their symptoms can persist for a long time. So let's go through some different conditions and see if we can differentiate between them. Bipolar II disorder and borderline personality disorder are sometimes difficult to distinguish because both conditions can involve symptoms like impulsiveness, emotional dysregulation, inappropriate extreme anger, poor judgment, a lack of insight into their condition, and difficulties with their relationships. So how do we tell them apart? We look at what's different in the conditions. First, in borderline personality disorder, their mood can go from high to low and back again a lot more quickly. A person can have several highs and several lows all in one day. In bipolar II disorder, the mood fluctuations tend to be slower and moods tend to last for a few days or a few weeks rather than for a few hours. Another difference between bipolar II and borderline personality disorder is that the period of high energy in bipolar disorder is almost always followed by a significant period of depression. With borderline personality disorder, that's not the case. People in a high episode of bipolar II disorder can go for several nights in a row without needing to sleep, while still having a lot of energy during the day. In borderline personality disorder, people don't stay up all night for several nights in a row and then feel high energy during the day. If they have trouble with sleep, it's because they want to sleep, but they can't. And if they don't get enough sleep, they feel tired during the day. Another difference is that when someone with bipolar II disorder can't sleep, they're usually up all night cooking, cleaning, or writing what they believe will be the next great Canadian novel. The person with borderline personality disorder, though, is just trying to get to sleep. Another difference between the two conditions is that in bipolar II disorder, a person can feel euphoric and grandiose. They can have racing thoughts and rapid speech, as though they were on speed. These things don't happen in borderline personality disorder. While both conditions can involve impulsive behavior like overspending, self-harming, or sexual promiscuity, the impulsiveness of borderline personality disorder tends to be more chronic and steady over time, while the impulsiveness of bipolar II disorder tends to be more episodic, only happening during a period of high energy. While both conditions can have periods of depression, only bipolar II disorder has discrete episodes of high energy in combination with euphoria, paranoia, irritability, or grandiosity. Finally, there can be some stigma associated with a diagnosis of borderline personality disorder. This is one more reason why we want to get the diagnosis right. Two conditions that are important to distinguish are complex PTSD and borderline personality disorder. One reason why it's important to clarify the diagnosis is that while both can result from the experience of trauma, it's not always the case in borderline personality disorder. If we diagnose someone who has C-PTSD as having borderline and don't recognize that they're suffering from trauma, they're going to miss out on receiving the specific trauma therapy that would help them to heal. There are a number of similarities between C-PTSD and BPD. Both can have symptoms of anxiety, impulsiveness, aggressiveness, and difficulty with relationships. Both can involve difficulties with emotional regulation and with self-esteem. The difference is that in borderline personality disorder, they don't have nightmares or flashbacks. They don't have dissociative episodes either. They don't tend to avoid situations, places, or people that are associated with a traumatic event of the past, and they don't get triggered into extreme anxiety reactions or into distress when they're reminded of past traumatic events. People with C-PTSD tend to have long-term traumatic experiences like childhood sexual, physical, or emotional abuse, long-term domestic violence, living through war, or being a victim of sex trafficking. People with BPD can have had traumatic experiences, but not necessarily. Sometimes people think that they have attention deficit disorder because they struggle with their concentration, focus, and memory. The thing to be aware of is that people can have difficulties with their cognitive abilities due to many different conditions. For example, cognition can be adversely affected by depression, anxiety, or stress. People with PTSD tend to have dissociative episodes. This is when they space out or lose track of time, and it can have a significant impact on their ability to concentrate and focus. It can also affect their memory. They can look like someone with ADD, but really it's the trauma that's causing them to be cognitively impaired. It's important to differentiate between ADD and PTSD because giving a psychostimulant to someone with attention deficit disorder can often help them to focus, but giving this medication to someone with PTSD can potentially make their intrusive thoughts worse and can cause them more distress. Also, if they're misdiagnosed with ADD, they won't be receiving the trauma treatment that they need in order to heal. Over the years, I've encountered some mental health practitioners who don't like to use what they call labels. They say that labeling a person causes them more harm than good. I disagree with this because if we don't know what mental health condition we're dealing with, we don't know how to approach the treatment. The individual who is struggling with a mental health condition is likely to miss out on getting timely treatment and the correct treatment, and their suffering is most likely going to persist. These are the reasons why it's so important to understand the differences between these conditions and to come to the right diagnosis.